Hello and welcome. I'm Steve Clemens, editor-at-large of The Hill. Thanks so much for joining us for our program today titled The Future of Medicare and Oral Health. Before we begin, I'd like to thank our sponsor, CareQuest Institute for Oral Health, for supporting today's conversations. Currently, Medicare does not cover oral health services as a standard benefit. If you've been keeping track of the Build Back Better legislation Democrats have been pushing in Washington, you'll know it includes an effort to expand Medicare by including dental, hearing, and vision coverage. Recent studies have found that nearly half of all older Americans and people with disabilities who receive Medicare benefits lack access to the care and resources they need to maintain good oral health. Poor oral health is often linked with other diseases, particularly affecting low-income seniors and those in rural and minority communities. Today, we're going to discuss potential challenges to Medicare and what that could mean for more integrated and equitable oral health care for beneficiaries. Before we begin, a few housekeeping notes. You can tweet us at The Hill Events using the hashtag #TheHillMedicare. We're broadcasting live, and we're going to take your questions throughout the program. As with any live stream, the funniest part for me, you could experience some occasional trouble. Refresh the page and it will all get better. Joining us to kick off the program is Congresswoman Nanette Barragán from California, a member of the Energy and Commerce Committee and a co-sponsor of the Medicare Dental Act of 2021. I spoke to her just a bit earlier.
Congresswoman Barragán, it's so great to see you, and thanks for joining us. This is not a topic I have dealt with before. It's something I didn't know very much about, but I just want to start out. Why isn't oral health covered under Medicare? Why isn't oral health, part of the health package?
Well, it should be, and that's a really good question, because we know that oral health and having access to a dentist for dental health is directly tied to our health, and it's directly tied to our heart. And so I think that, frankly, when they devised this coverage many, many years ago, I believe in 1965, they didn't have that. They didn't think about the tie and the connection. We clearly know about it now, and people point to cost, but we have to make sure that we are covering this because it's directly tied to healthcare and preventive care, which is so critically necessary.
So, I also noticed that in the Black community, the brown community, that there are a lot of folks that are avoiding dental care. Is it because of cost? Is it because there are other speed bumps out there in the way of that? And do you think by basically raising awareness about this broadly and dealing with the cost issue for a lot of folks so that it becomes more a natural part, we'll see more people building in, dental care into the way they approach their own personal health?
Well, people of color are disproportionately impacted by the current lack of dental coverage in Medicare. So adding dental coverage to Medicare is one step toward getting to racial health equity. Part of this is cost. Part of this is education on making sure people understand that seeing your dentist and making sure that you're flossing and you're brushing and all the things that go with dental care is directly tied to your health and is preventive care. And so I think there's a lot of those. Just in my own family, I can tell you my father never had teeth. My father was 59 when I was born. I never knew him to have any teeth. My mother, same deal. She had teeth, but she never wanted to go to the dentist. Part of that, no doubt, was cost, but the other part is education. But part of addressing equity is going to be access to dental care coverage, which is why this is so important. This is not a luxury. This is a necessity that we need.
Tell me about the bill that you are introducing to try to, this Medicare Dental Act of 2021. What would it actually do?
So my bill will allow there to be coverage for dental care for those who have Medicare. And we know that right now, there is a lot of conversation and a lot of talk about getting dental coverage and hearing and vision. So we know there's momentum behind this. One of the concerns that I have is that the current proposal under the current Build Back Better agenda is that the dental coverage doesn't kick in until several years. And really, people need that coverage now.
Right.
And so it's really important. If we take a look at like a 2019 CDC study on oral health, it found that 71% of Black Medicare recipient beneficiaries and 65% of Hispanic beneficiaries did not see a dentist in the last year, compared to only 43% of white beneficiaries. So there is a huge gap here, and there is a huge need here. And we need to start by making sure that those who have access to Medicare have access to dental coverage.
When you talk to your colleagues, and I'm also aware that you have a lot of colleagues in the House, I think more than we've ever had before, who are actually medical doctors. I don't know how many are dentists, but the medical profession is pretty well represented amongst your colleagues in Congress. Are you finding a lot of support for what you're doing? Are you finding resistance?
No, there is a lot of support on providing dental coverage. Unfortunately, depending on who you talk to, it comes down to a conversation on cost. Can we afford it? And what I like to tell people is part of the problem in the United States is we focus too much on being reactionary instead of preventive care. That's going to save us money in the long run, which is why dental coverage is important. They'll recognize the importance of it, but it comes down to cost. So it just depends on who you talk to and on what side of the aisle you talk to folks. But I do know that there is a lot of momentum on this right now. And so I am hopeful that we can get this across the finish line.
But look, I find it a really interesting question. I mean, it's sort of a meta question, right? That this notion of cost, I understand there are cost issues, but it also perpetuates this notion that it's optional, right? That dental health and dental hygiene and dental care are optional. And I have to tell you, like you have family members, I have colleagues in where I work with, who have just suffered a major, health challenge because of, dental issues. And so I think one of the things that's perpetuating out there is you're going to change the frame. Part of it is to look at a person's whole health, which is what I thought the Affordable Care Act was trying to do in a wellness perspective. So, if you get back to wellness, wouldn't dental health automatically be part of that package?
Absolutely. And you have to remember our bill is just a step in that direction because it's only for Medicare recipients. It's not universal, which we need to eventually get to. And frankly, important that kids have access to dental care because it starts very young. But you're absolutely right. There is a very clear connection, which is why I think it's important that we continue to push this notion of providing that coverage to everybody. We're hoping that Medicare recipients can be the start of that because it's, as you've mentioned, dental care is a crucial part of healthcare, and it's really not a luxury. And, there's also this fear sometimes we talk to folks about going to see a dentist. And part of that, I think, has to do with the fact that if you didn't see a dentist when you were younger and you're not used to it, there could be that added fear to it.
One of the other steps that I know that you have been part of and supported is you recently voted, as I've been told, for the dental insurance program for veterans and the Veterans Administration. And so is that, I think the logic of that makes a lot of sense given what you're trying to do. I don't know what the vote count was. Was there much opposition? Was there a party line vote when it came to providing dental insurance for veterans?
Well, let me tell you, the number one group that we should be taking care of are our veterans who are coming home and making sure they have access to all the care. So I'm glad to see that the dental benefit for veterans is now happening. And we often hear on a bipartisan basis that we're going to take care of our veterans, and it doesn't happen often enough. I'd have to go back and kind of check to see what the final numbers were. But I'm glad that we got it through and that, our veterans are getting this benefit that's so critical.
As we're thinking about this, while we have just a minute or two left, I'm interested in the debate that's been happening in Congress over the reconciliation bill. I mean, there are just lots of different frames. It's so big, I'm not even sure what's in it or not. I'd like to know whether your efforts on dental coverage are covered in the reconciliation bill. But I'd also like to kind of ask you the question when it comes to your district, your district and your constituents in California. How do you feel the reconciliation bill as it's shaping up is going to affect their lives? Is there the connectivity between that bill and what's being discussed and what you're trying to deliver for your constituents?
Well, first of all, my bill, the Medicare Dental Benefit Act, just had a hearing in Energy and Commerce last week, and it got a markup, and it is included in part of the $3.5 trillion reconciliation package, which we're calling the Build Back Better agenda. So it is in there, and that's the good news. When it comes to my constituents, we're talking about a district that's the fourth poorest in the state of California. Across the country, it's on a list of about 358 at 435. So we're talking about the folks that really cannot afford a $400 bill, which is very easy to get if you see a dentist. So this bill will be critically important for them to get access to dental coverage. But the reconciliation bill overall has many things in there that families need, that working people need, that we hear day in and day out. Make sure you're there fighting for these things, whether it's in-home care and expanding access to that, whether it's childcare. There are so many things, paid family medical leave. I mean, the thought that you get sick and you cannot take time off and have that paid family medical leave to recover and take care of yourself or a sick one, it's nuts. So people are counting on us to get the Build Back Better agenda done. And I have to remain optimistic about that ability, including this portion of reconciliation of the dental coverage for those with Medicare to get across the finish line. People are counting on us.
Well, listen, I just want to say thank you. This is a topic I haven't discussed before. I sort of thought it was part of the package of health and Medicare out there. I'm very glad to hear about your work. So Congresswoman Nanette Diaz Barragán from the 44th District in California, thank you so much for your time today.
Thank you, Steve.